almost similar, just that the children get severe symptoms because their airways are much smaller and they're still growing compared to the adults. So they present with the same features: cough, chest tightness, easy fatigability during exercises, and also wheezing. So the children tend to get more of those symptoms as compared to the adults. However, the symptoms are similar. Yeah.
Let's talk about now parents now. You know, sometimes they have the child back at home, but if you're talking about antibiotics, sometimes the child will be coughing and they're giving them antibiotics, but is that a manageable drug for asthma or respiratory tract infection, and what are the long-term effects of, you know, going that antibiotics way?
Yeah, well, so we are not supposed to use antibiotics without evidence that there's an ongoing bacterial infection. So misusing the antibiotics can actually lead to resistance of the organisms that are usually responsive to it. So it is advisable not to use antibiotics oftenly for viral infections or for just symptoms of asthma unless there is an ongoing bacterial infection. Usually there's a high fever, there's a productive cough, there's chest is hurting, or there's evidence of infection either in the blood test or on a chest x-ray. Or the doctor has advised that we should use an antibiotic. Yeah.
All right. Okay, I cut you short. I'm sorry.
No, it's okay. To avoid resistance to the medicines. Yeah.
So what is the difference between upper and lower respiratory tract infection in children, and why is that distinction quite critical when it comes to treatment? Excellent.
So upper respiratory tract infections, a lot of them involve the nasal passage all the way up to the level of the vocal cords. That's one we call upper respiratory tract infection. So they present with a lot of running nose, nasal blockage, sometimes noises coming from the upper respiratory tract infection, like the common cold. That's an upper respiratory tract infection. Sometimes even that can affect the eardrums as well, what we call otitis media, because there's a lot of communications from the ear to the throat and the nasal passages. So a lot of viruses tend to cause that.
Okay, and just hold on to that point. We'll be coming back to it, but let's hear from Sheila. We have a caller. Sheila, good morning.
Good morning.
Yes, talk to us.
Hello?
Yes, Sheila, we can hear you. Talk to us.
Nilikuwa nauliza.
Yes.
Niko na mtoto wa 6 months. No, 7 months now. Sasa kuna time alikuwa na homa, alikuwa na hiyo akona hiyo whistling sound. Alafu nikaenda hospitali nikapewa dawa. Baadaye hakupona kwa hiyo dawa. Nikarudi tena nikaambiwa nibadilishe dawa. Sasa kubadilishia dawa akakuwa sawa, lakini saa hii baada kuna hiyo nini? Yaani anapumua kwa haraka. Sijui shida inaweza kuwa ni nini.
Okay. Asante sana Sheila for your question. Let's direct it to Daktari.
Oh, thank you. So I can hear even the baby is crying in the background.
Yes.
So if there's cough, running nose, and fast breathing, a lot of times those are signs of a lower respiratory tract infection. So that child could either have a bronchiolitis or a pneumonia. So if there's wheezing, that's more likely to be a bronchiolitis. So a lot of times it can clear on its own, but if it's severe, if there's fast breathing, the breathing is very fast, more than the clock, 60 breaths per minute, that is a bit fast. So we usually recommend to go back to the hospital. We measure the oxygen levels. If there's wheezing, we try to give medicine to try and see if it will clear it, to open up the lungs. So, but if the child is okay, is feeding, is breastfeeding, there's no fever, we continue to support. We put some drops in the nose to clear the nasal passages and hydrate and breastfeed more and keep warm, and the symptoms usually go away. If it's a pneumonia, the doctor says, listens and says that there's a pneumonia, then the doctor will give an antibiotic to treat the pneumonia, and the symptoms will get better. So I would advise her to go to the nearest hospital again to see if the symptoms are getting better or not, and if the child needs any antibiotic or medicines to help with the wheezing.
So should she change the hospital?
she can go back to the same hospital if it's very close, and just tell the doctor that the child is not doing better. It is okay. Usually we say come back if there's no improvement.
All right.
Yeah.
But sometimes, you know,